So Tisa-cel, or Kymriah, is an approved CAR-T product for patients with large B-cell lymphoma and follicular lymphoma. Most of the research I've participated in is for patients with large B-cell lymphoma who are treated in the third-line setting and beyond in the CIB-MTR database. And our most recent report has over 1,000 patients who were captured in the database and infused with Kymriah, and we show very similar response and survival rates to the patients who were treated with Kymriah on the JULIET trial. And interestingly, we're able to show this with a large proportion of patients who would not have been eligible for Kymriah based on primarily medical comorbidity. So roughly half the patients had a medical comorbidity that we feel would have made them ineligible for the study. So it sort of proves the efficacy of CAR-T in the real-world setting where patients often may be less fit and not trial candidates. We also saw very favorable safety outcomes, including lower rates of CRS than were attributed in the original trial, which might be due to earlier use of tocilizumab, and confirmed very low rates of ICANS, both of which are important for patients going through this therapy, and it's important to see that they don't experience much toxicity. And we also looked at older patients and who experienced similar outcomes to younger patients, and did some other sub-analyses. But essentially, it's a very favorable therapy in the real-world setting, and we do know we can safely and effectively treat patients with Kymriah who may not have been candidates for the original clinical trial.